Hello, my name is Alyssa Miller, and I chose to do my rare disorder presentation on hemimegalencephaly. Hemimegalencephaly is a rare neurological disorder where one half of the brain is larger than the other half. It is also called a hematomatous malformation of the brain that affects all or part of the cerebral hemisphere. This disorder is very rare, and doctors are still learning how to treat hemimegalencephaly, especially since each case is different. Over here, you can see a picture of the brain. This side would be what you would consider the normal side, and over here is the side of the malformation. As you can see, there is a much larger growth in this part of the brain compared to this side. My story. In the year of 2013, my brother Silas was born. He was healthy, happy, but little did we know things would come to a stop in 2015. A normal night turned scary when Silas stopped breathing in his sleep. He was rushed to the hospital, and they basically just told us to keep an eye on it and to come back if it would to happen again. And sure enough, it did. The second time he stopped breathing, it took longer to bring him back, and that's when they took their first EKG of his brain and saw that he had some malformation in his brain. After many specialists and many hospital stays, he was diagnosed with hemimegalencephaly. He is now 11 years old, and we are still learning what his life has in store and what we can do to ensure he has as normal of a life as possible. He is considered one of the most rarest cases due to the fact that in a typical hemimegalencephaly case, a child only uses half of the brain. And because of that, they are able to disconnect half that brain or remove the half of the brain that is not functioning. But in my little brother's case, he still uses both sides of the brain, even though the one side is much larger than the other. Here are some treatments for hemimegalencephaly. They have a hemispherectomy, which is where they can remove the part of the brain that is no longer functioning. Like in this picture here, this shows the brain, this part of the brain no longer works, whereas this part still does. And that's kind of the same with the anatomic hysterectomy. That's when they can disconnect the brain. It's a less invasive procedure, but it can still have its challenges as well. Other things that they do for children with hemimegalencephaly is seizure medications, physical therapy, as well as genetic testing to see what type of seizures may be common and what treatment would be best. It's really hard to say what is the best course of action, but with genetic testing, it can show who else in the family may have a seizure disorder and what kind of medications they used and what worked best for them. Some of the effects of hemimegalencephaly are seizures such as epilepsy, absent seizures, and compulsive seizures. Now, some may know, but others may not. Absent seizures are where a person's body, it may look like they are zoned out, but in reality, they are currently having a seizure. For my little brother, it may look like one of his eyes being in a different direction than the other eye, or he is laughing uncontrollably, he's drooling, or his body is kind of just stuck in place. Other things can be developmental delays such as autism and learning disabilities, weakness of the body or motor difficulties, and vision problems. It has also been found that children who have had a hemispherectomy may result in vision loss due to the procedure. For the life expectancy and prognosis, it is very hard to say. because this disorder is so rare and doctors are still doing their research trying to figure out, why this occurs and how they can help a child who has hemimegalencephaly. For some children, they may live a semi-normal life. Others may have a hard time as they enter adulthood. In most cases, doctors are able to perform a hemispherectomy, which can have a 2 to 7% mortality rate. Overall, though, there is no cure, and it's kind of just a learn as you go. As a child continues to grow, so does the research for this brain disorder.